Peace be upon you and God's mercy and blessings. Doctor, I have kidney failure and I'm on dialysis, and I always end up drinking more fluids than I should every day. Are there any important tips I can follow to help reduce the amount of fluids I drink each day? Also, does drinking too many fluids really make a difference? I mean, if I drink a lot of water, will that affect me? Stay with me in this video because I'll tell you the most important tips you can follow to reduce the amount of fluids you drink. What are the risks that can happen to you as a result of drinking too many fluids? So the first thing we need to know is that a kidney failure patient doesn't pass much urine from the body. A healthy kidney is supposed to remove a certain amount of toxins and fluids. With kidney failure, the amount of fluids leaving the body becomes almost non-existent. Simply put, the patient can't urinate. As a result, swelling occurs in the body, and because of that, swelling happens in the body. The excess fluids cause high blood pressure and put extra strain on the heart. A dialysis patient undergoes 3 sessions per week, which means there's about a day or a day and a half between each session. This means that the amount of fluid you're describing accumulates inside the body, and as a result, it causes the symptoms we've mentioned. So what exactly are these fluids? These fluids include water, tea, coffee, juices, all types of beverages. It's not just water that's considered fluid. So what tips can you follow to reduce your water intake? For dialysis patients, the first thing you can do is rinse your mouth. Rinsing helps reduce the feeling of thirst. The second thing you can do is use gum or chewing gum, as our elders used to say, to help reduce the feeling of thirst. The third thing, and this is very important, is to always stay in a room with a cool temperature so you don't feel thirsty. Fourth, always make sure the water you drink is cold. Drinking warm or room temperature water makes you drink a larger amount, but cold water reduces the feeling of thirst. Number 5, reduce the amount of salt you eat in your food. Even a small pinch of salt that you add to your food makes you need an extra liter of water. The sixth and final tip is that you can always change the taste of water with lemon slices to give you a refreshing feeling. At the same time, it also reduces your feeling of thirst. One last tip you can use is to use ice cubes. When you feel thirsty, put an ice cube in your mouth to moisten your mouth and reduce the urge to drink. So don't immediately go and drink water. Okay, doctor, I've heard about something called dry weight. What is dry weight? And why does the doctor always tell me to try not to let fluids increase in my body? Dry weight is simply a weight that we determine for kidney failure patients. We can remove the fluids present in the body without the patient feeling any kind of weakness or loss of appetite. For example, if your dry weight is 100 kilos and you come in weighing 102, that means we should remove 1 kilo of fluid. We determine this dry weight at the start of dialysis based on the amount of fluid we can safely remove without causing you any weakness or fatigue. So does this dry weight stay the same or does it change? No, it changes. If after dialysis your appetite improves, you start eating more and your health gets better, your weight might increase, and at that point the weight gain isn't just water as we usually call it. It could be muscle or fat. In that case, we adjust your weight. That means your dry weight should gradually change. The doctor adjusts it based on how much food you're eating, your appetite, and the rate of change. But ideally, you shouldn't gain more than a small amount, about 2% of your weight, between dialysis sessions. As we agreed, these fluids include water, tea, and all kinds of beverages. One last piece of advice, or as they say, a take-home message. Paying attention to the amount of fluids you drink is not a luxury. It's something very necessary to maintain your health. Take care of your health. Your health matters to me. And don't forget, we made this video for you today with good intentions. I also hope that you did something good today and always make it a habit. Like, share, and benefit others. I'll see you next week to check on you and reassure you. May God keep you safe.